Welcome back. As we head into the warmer months, we have to reacquaint ourselves with those pesky bugs like we talked about last week. Well, the bug spray is going to come in handy this week because we're talking ticks. No one likes to find this particular creepy crawly on them, or more likely on their pets. Let's start off with what are ticks, aside from literal bloodsuckers. Ticks are small arachnids that belong to the order of however you say this word. They are ectoparasites, meaning they feed off the blood of mammals, birds, and sometimes reptiles and amphibians. Gross. Here are some key points about ticks. Their life cycle. Ticks have a complex life cycle that typically includes 4 stages: egg, larva, nymph, and adult. Ticks require a blood meal at each stage to progress to the next. Depending on the species, the life cycle can take anywhere from a few months to several years to complete. Habitats. Ticks are commonly found in wooded or grassy areas where they can easily attach to passing hosts. They thrive in environments with high humidity. Feeding behavior. Regardless how gross it is, ticks use specialized mouth parts to attach to their hosts and feed on blood. They secrete a substance that helps them anchor firmly to the host's skin while they feed. Ticks can feed for several days to a week, depending on the species and life stage. Disease transmission. We talked about this a little bit last week, but ticks can transmit a variety of pathogens, including bacteria, viruses, and parasites to their hosts during feeding. These pathogens can cause various illnesses in humans and animals alike. Prevention. Preventative measures to reduce the risk of tick bites include wearing protective clothing, such as long sleeves and pants, using insect repellents containing DEET or picaridin, like we talked about last week, avoiding tick-infested areas when possible, and conducting thorough tick checks after outdoor activities. After checking all of your hair and the nooks and crannies, we move on to tick removal. If you find a tick attached to your skin, it's essential to remove it promptly and correctly to reduce the risk of disease transmission. Use fine-tipped tweezers to grasp the tick as close to the skin surface as possible and pull upward with steady, even pressure. Avoid twisting or jerking the tick, as it can cause the mouth parts to break off and remain embedded in the skin. Ticks are significant hosts of various diseases, including Lyme disease and Rocky Mountain spotted fever. Tick-borne diseases are illnesses transmitted to humans through the bite of infected ticks. Ticks can carry a variety of disease-causing agents, including bacteria, viruses, and parasites. One common tick-borne disease is Lyme disease. Lyme disease is characterized by symptoms such as fever, fatigue, headache, and a characteristic bullseye rash. If left untreated, it can lead to more severe complications affecting the joints, heart, and nervous system. Ticks are a concern for public health due to their ability to transmit diseases, so it's crucial to take preventative measures and be vigilant about checking for ticks after spending time outdoors, especially in areas where ticks are known to be prevalent. Two Rivers Public Health Department actually has quite a few people that go out and collect ticks within our district to conduct surveillance of tick populations and the diseases they carry. By identifying species in our area, we can determine if a certain disease might start to appear as people get bit. Additionally, the ticks we collect will be tested for pathogens, so we can know what areas might have ticks carrying diseases. Doing all of this helps us better educate the public on tick-borne diseases and helps our surveillance team and healthcare providers know which diseases are in our area so they can make better diagnoses. Thanks for watching, and as always, stay happy and healthy. Until next time.